Clearly, our patients with mood disorders suffer tremendously. Although we have treatments for many, they are suboptimal. We see low remission rates, as I'll talk about. And the main thing is the lag of onset of action. Most of our treatments, antidepressants, take probably 8 to 10 weeks for full antidepressant effects. What we're talking about is shifting the paradigm to treatments that work in a few hours. Depression is the leading cause of disability worldwide. And not only is there significant morbidity, but there's significant mortality. Here we see the mortality from major medical causes. Here's the peak between 1965 and 1995, and how we're doing over the years through discovery in terms of mechanism, pathophysiology, or for that matter, developing novel treatments. We can see, for example, all causes of leukemia, there's been a significant decrease in mortality, followed by 1 million deaths that have been averted for new treatments in heart disease, significant improvement in AIDS, and in stroke. That's not to say that we can't do much more work into improving the decrease in mortality from these illnesses. But what about our major mental disorders? What about suicide? We haven't made a single dent in the number of deaths for suicide. In fact, we see increases over time. And for that matter, if we believe that we're doing, one measure of how we're doing is by decreasing the prevalence of severe mental illnesses. We have not significantly decreased the prevalence of our severe mental illnesses. Mood disorders consist of the major ones of major depression and bipolar disorder. We can summarize them as individuals who have disturbances of mood, behavior, circadian rhythms, and activity levels, which cause severe impairment in the ability to function. Mood disorders result not simply from low levels of serotonin and norepinephrine and other monoamine transmitters, but now are viewed as disorders that have significant disturbances of synapses and circuits. Now, a single individual can have any mixture of symptoms. Here, this figure depicts an individual, the same person during the depressive state and during the manic state, sitting down, depressed, staring into the distance, preoccupied with inner thoughts. Whereas the same individual during the manic state is probably pacing back and forth, talking non-stop, dressed in multiple layers of clothing and carrying many items.
Congratulations, Carlos, to you and the other pioneers who are really bringing forward the first new treatment for depression in decades. So there's another new wave of treatment which involves drugs with dissociative effects, and this is the use by Roland Griffiths and also some researchers in England of psychedelic drugs, yes, actually, including psilocybin in the treatment of PTSD and also in the depression that can accompany end-of-life preparation. And they're reporting some pretty remarkable results with these drugs that may disrupt default network. So you're emphasizing that the ketamine's effect really may not be through the dissociation, but do you see any parallels to the effect of ketamine with the effects of these other drugs that
and so
that are
we
dissociative?
have, and that's an interesting question, and there's a very nice review in Nature Neuroscience about these psychedelic drugs and perhaps their role in psychiatric disorders. And so ketamine does produce at certain doses cognitive effects, which is interesting. Scopolamine has antidepressive effects, does produce cognitive effects. These other drugs do produce cognitive effects. Is there a common link? But that is, now remember some of these drugs were used in the past with psychotherapy, psychoanalysis, and they reported improvement, but of course, for restrictions, its use was stopped, and we didn't have many of the tools and technologies that we have today, so we can get a better sense. What are the circuits turn off with these drugs, how connectivity is increased or decreased, and what parts of the brain it is. And so now some people are doing these studies, and there haven't been many larger replicated studies yet, and it's a very difficult area of research for obvious reasons. I think it's a fascinating area. I do think, it does deserve a second look at, and to see what role they may or if not have. They're also used in hospice care and pain management and so on and so forth. Thanks.